It's been a while that you guys have actually seen me on the channel, and I took a step back, but I guess I'm back now. And I'm back with a whole lot of content that we're going to be doing. Grab your piece of paper, and let's go. Hello and welcome to Hospital Survival Guide. This is a new season and revamping on the channel. And we're going to be talking about real issues concerning medicine, real issues concerning survival in the hospital. If you haven't yet subscribed to the channel, please hit the subscribe button, hit the bell notification icon so you never miss on such amazing content every time I post. To Zambia and beyond, subscribe, tell a friend. What are you waiting for? Yeah, so you're probably wondering what this video is all about. And I had actually to put this together so that I could actually make a video, especially in 2026. And I was thinking to myself, is medicine really worth it, or is it worth doing in 2026? And having a look at the things that I've gone through, the things that I'm going through, there's a lot that we have to unpack. But I want this video to be partly also sort of like a moment which we have to share with you guys, as you have been following me on my journey. And I really also want to talk about how I actually became MK7. A lot of people wonder how I reached where I was. A lot of people wonder how I managed to do what I do. A lot of people wonder, what do you do? Does this guy even have a life outside the hospital? Do I? I guess you just have to find out. So it all started in medical school. As you already know, I didn't do part of my primary school. Actually, I did my primary school and my secondary school in another country, and only came to Zambia when I was doing my medical school, and that was back in 2015. So, learning in a different country, and even the education systems actually differ in terms of the way education is actually done out there compared to the way education is actually done here in Zambia. The education system here in Zambia has its advantages, it also has its disadvantages, but generally when you look at the education system in terms of primary school, in terms of secondary school, there's a lot of exposure that is there, and I think so many, like the classrooms are crowded, it's very difficult to actually keep track of the lessons, and sometimes it's very difficult, especially for a particular person who's growing up, and it's very easy to lose interest and to lose perspective because you have a lot of people in the class. Of course, yes, that's with most of the government schools that are there in the country, but with the private schools, I think the numbers are a bit more limited. So growing up in a different country, the numbers that we'd have in our class were very small, and we would often have let's say 30 people in a class, and if you had 50 people, that was a lot. And 30 people here in a government institution, that's a very good day, a very, very good day. So when I came here and then I was exposed to the education system that was here now, it was a bit different at first. There are some striking differences in terms of how learning is done here, and even university itself. It's a unique experience. You go through a lot of unique things. And I recall back, it all started back in third year. So in third year, that's where you actually get into medical school, back when medicine was 7 years. I don't know you people that are doing 6 years. Anyways, medicine was 7 years back then, and when I was in my third year, that's when you enter into medical school, because the first 2 years are pre-medical sciences. So where you're looking at mathematics, the pure sciences and all that stuff that I've totally forgotten about. So third year was where I now had to do my pretty much first year of medical school. That's where we had to learn things like biochemistry, that's where we had to learn things like physiology, that's where we had to learn things like anatomy, that's where we had to learn things like pharmacology. And someone gave me an analogy, because when I was in second year, I used to play quite a lot, and I was pretty much all over the place. I would watch a lot of movies, I would watch a lot of series, I would barely study as much, but you would still end up doing so well at the exams because the bulk of the content that was there at second year is quite limited. And once now you get to third year, that was actually traumatizing, like very, very traumatizing. So when you actually get to third year, you get exposed to more and more of the content. You get exposed to more of the medicine, the real medicine in terms of the preclinical sciences. So these were quite wide. And that transition that you make from second year getting into third year, it happens very quickly. And before you know it, you are a third year student, you have a lot of information that's coming at you. Someone gave me a nice analogy that explains how medical school actually works. In pre-med, that's the first 2 years, it's like you open a tap and you're trying to drink water from that tap and it's coming out at a very slow pace. It's very easy to put a cup there. You can even put your mouth there and drink that water from the particular source. But if now, let's say you get into third year, you now open the tap full blast and you're trying to drink from there. Fourth year, I don't know if you know what a fire hydrant is, but if you've seen a fire hydrant, or let's just say a fire truck, that hose that they use to put out fire on the fire trucks. I mean, if the fire trucks have water, but anyways, I'm not throwing shade here. So you're trying to put out water with that hose. And what's going to happen is that imagine you're trying to drink water from that particular hose pipe. And once you try and drink water from that particular hose pipe, it's very difficult to drink water because it's coming out at full pressure. That's what fourth year is all about. Now, fifth year, sixth year, seventh year is like it's raining now all over. And you try and go outside, open your mouth, and then you're trying to actually drink water from the rain, which is also not really a feasible thing to do. So getting into third year, and I had all this information that was coming at me thick and fast, I had to find a way that would make this information much more feasible to use for me to be reading on the go. Because by then, I didn't have some form of transportation in terms of a car, so I wasn't mobile at that time. So this meant that we had to actually carpool. So it means we had to contribute some money to pay one of the guys who actually had a car in our class and would often transport us from the pickup points from home up until we reach school. Now, having had this experience, sometimes I would actually get on the school bus, sometimes I would actually use public transport. And I found myself in a situation where you get home, you're very tired. Number two, you wake up quite early. You have to get on a bus. And that's already time that you're cutting out of your day. So I needed a way that I could utilize that time effectively. I needed a way that I could use to actually maximize the little time that I had. So I thought to myself one time, it's not feasible for me to have a textbook and to be carrying around a bunch of textbooks with me all the time. So it's best I have something that is made into a digital copy such that every time I'm on my phone, I can just easily whip it out, start reading on my way to school. I could just whip it out when I'm just sitting being idle, doing nothing. So that's how I thought of actually digitalizing my notes. And there was the guy that we're actually paying for the carpool once came to me and was like, he was quite interested. Like, what are you reading there? Because I was like studying something. I think we had a test during that period, and I was reading through something on my PC. So it piqued his interest. He was like, what are you reading there? Can I have a look? So that's how he read through. I was like, these actually look nice. They actually look easy to follow. Can you share this with me? That's how I shared it with him, shared it with a few other people, and before you know it, a lot of people had the work. So that's how it kept being shared on and on and on and on. But the whole essence behind that was just to make my life easier because, guys, I was tired all the time. And I just wanted something that is easy, good to read. And with time, it got shared on and on and on and on and on and on and on. And with more people hearing about the content, I mean, there are some people that read the content every day and they don't even know what I look like. There's some people that read the content that never even met me. And as time went on, I expanded the work. I expanded how I was making the notes. I did different things in terms of how I was relating to certain subjects. And that's how I would actually get my name slandered quite a lot. And because of the material that I would put out, the questions I would answer on the channel, the Oscar stations I would do, that got me into a lot of drama. And there's a point where I actually took a step back from it, and I told myself that I'm not going to talk about this, and I never looked back. And ever since I made that decision, it was, I think, one of the best decisions I've ever made, and I've never looked back, and I've never really thought about it. But that's not the meat of this discussion. I just wanted to give you some perspective as to where I was from and where I am right now, so that when I'm giving you the advice in terms of whether you want to do medicine now in 2026 or not, it carries a bit of some weight, because you have an idea of what exactly I went through and where exactly I am at the particular moment, and why this advice is quite valid. So, should you study medicine in 2026? Are you contemplating on studying medicine in 2026? Do you want to be a doctor? I've been a doctor for quite a hot minute, and it's had its advantages, it's had its disadvantages. There have been ups, there have been downs, and everything in between. And one thing off the bat is that one advice I can give you from the onset or from the beginning is that if your heart is not in it and yet someone else is living their dream through you, won't survive. Even if you do survive, because medicine, almost anyone can learn medicine. It's very easy to teach, it's very easy to pass exams. But even when you survive, you just won't care enough for the patients. You'll be doing certain things that will jeopardize your patients, and you wouldn't care enough because your heart is not in it. But if your heart is in it and it's something that you want, it's not something that your parents want, it's not something that your neighbor wants, it's not something that your partner wants, it's not something that your side chick wants, it's not even something that your pet wants, but it's something that you want. So it's going to be something that's good, because it's going to be coming from deep down in your heart. The thing about medicine is that if you don't want it hard enough, you won't put in the effort. If you don't put in the effort, you won't know things. And if you don't know things, you become a dangerous doctor. And if you become a dangerous doctor, we already know where that actually heads to. So the things that you must consider when you want to study medicine, especially in 2026, given the different circumstances that have happened across the country, of course, in the profession, the different things that we go through at work. There are certain things that you should actually know, and there are certain things that you should consider. And if maybe you're planning on applying, maybe this will be the video that will change your mind and say that maybe this is not for me. But off the bat, the first thing that you're going to do is make a lot of sacrifices, like a lot of sacrifices. This cannot be said enough, and I wish someone sat us down and told us the level of sacrifice that is going to be required for us to do medicine. You're going to sacrifice a lot of your time. Most of the times you'll be at the hospital, and it will be a point where some people will appreciate your efforts, some people will not appreciate your efforts. Some people may actually even shout at you, some people may actually even insult you. Meanwhile, they don't know the level of sacrifice that you've made. You're going to sacrifice your family. Invariably, one arm, whether your family or your hospital life, is going to suffer, because if you give more attention to your family, it means your practice suffers. If you give more attention to your practice, it means your family suffers. So if you're not ready to make that sacrifice and you're not ready to put in that effort, you will never reach the heights that you are actually meant to be. And it means that at one point or another, you're going to have, or the people that are around you, if they are supportive, they're going to have to understand that Of course, there's so much that one can understand in terms of you not being present all the time, you always being held up in work, and no, you're trying to find this balance. And I think I've been trying to find this balance, and I'm sure most of you have asked me, why don't you make so much videos anymore? Why don't you give us a lot of content? Why aren't you publishing more books? Well, it's more of finding a balance and not allowing one arm to suffer. And if you have more things that you do in your life, that's even going to be worse, because giving up those things may be extremely hard to actually do. The other things that you're going to be sacrificing are your friends, especially if your friends are not part of the medical program. Your friends are outside the medical program. It means that they're not going to understand, because all the time you're going to be tired, all the time you just want to sleep, all the time you either are caught up studying because you are behind, or you are caught up studying because you have assessments or you have an exam, or you're caught up studying because you feel like as if when you go to the hospital you don't know what you're doing and you feel like you're going to kill someone. So that is actually a very scary thought. And even in terms of medicine, you never reach a point where you're confident and you're like, I know what I'm doing and I'm doing the right thing. Often, as you go higher and higher on the levels, you actually get to realize this, that a lot of people sometimes wing it, and some people are actually quite embarrassed to say it. They don't want to talk about it. They act like as if they know it all, but a lot of people are actually winging it. And this imposter feeling is very common, especially among medical professionals, especially among doctors. And it doesn't mean that it should actually stop you from pursuing the career in medicine, but just know that it's something that you never really truly master, because what you know today, what you master today, can become obsolete tomorrow. It can become obsolete a few minutes later. Guidelines are changing all the time, so you have to be constantly reading. So if you're someone that really hates reading, medicine is not for you. If you're someone that doesn't have a heart for people, medicine is not for you. If you're someone who's not patient, medicine is not for you. If you're someone who likes the challenge, you're someone who is well-driven, you're someone who's self-motivated, yeah, give it a try. If you're someone who is doing it for the wrong reasons, especially what we call negative energy, toxic and negative fuel, you're doing it because you want to prove a point that you can do it. You're doing it because you want to prove a point that this is easy. Everyone else has done it. I can also do it. Then you end up becoming one of those frustrated doctors, one of those doctors that don't really care. So if you find yourself in medicine and you're finding yourself making that decision about whether you should apply to medical school or you shouldn't apply to medical school, ask yourself these things. Are you willing to make that sacrifice? Are you willing to sacrifice your time? Are you willing to sacrifice your social life? Are you willing to sacrifice your family life? Are you willing to sacrifice your own sanity at times? Because I think it's not normal to study medicine. It's not normal to work the way we work. Maybe it's different in other countries, maybe it's different in other places, but often you find yourselves doing more, going above and beyond, especially if your heart is in it. And if your heart is in it and your answer to all these questions is yes, then go ahead and do medicine. But if your answer is no to any of these questions, then sit back and think, and introspect to yourself, and actually think, is this really for me? Am I going to thrive? If I actually graduate, am I going to make a good doctor? If your answer is no, then maybe medicine is not for you. To the next video, my name is Dr. Moses Kazevu. Until next time, bye-bye.